An Atlanta man on his honeymoon with his wife is now paralyzed after a seemingly minor surfing accident. Let me break it down for you as to how this rare condition can happen. He suffered what's called surfer's myelopathy. Surfer's what? Yeah, actually, this is the first time I've even heard of this condition, so I had to look it up and explain it to you guys. It almost uniformly affects young novice surfers with no history of back issues. It's non-traumatic, meaning that he didn't fall off the board and break his back, but he suffered a vascular injury to his spinal cord. This happens if you stay in the prone hyperextended position for too long, like when you're on a surfboard. He stated when he popped up on the surfboard, he felt a little twinge in his back. He went on to surf for about another hour and then went to lunch with his wife. When he got up to pay for their lunch, he realized that he could not move his legs, and he was taken to a local hospital where he was diagnosed with this condition and is now paralyzed. This can happen because the spine is mobile, it moves, and we have a lot of blood vessels that surround and vascularize both our spine and the spinal cord. So anytime we move our spine, these blood vessels move with us, and if we're in a position that we're not used to, like hyperextending your back, you can actually damage the blood vessels that supply the spine. We don't know what exactly happens in these conditions, but what we suspect is the pathophysiology is that when you hyperextend your spine, you can actually kink off the artery of Adamowitz, which is the major vascular supply to our spinal cord. Here on the lateral view, you can see where this artery enters the spine and vascularizes our spine. So if this artery gets kinked off, you can actually deplete the blood supply to the cord itself and suffer what's called anterior spinal cord syndrome. In other words, you can have a spinal cord stroke. It's thought to be some type of transient ischemia or even dissection of these vessels. Unfortunately, 42% of the time, these patients don't recover. Now, don't worry, there is only 64 cases documented in the literature, but it can happen, so here are some tips to help you prevent this. If you do decide to go surfing, don't lie in the prone position for too long. So if you're in between waves, sit up in a regular position on the board. And most importantly, if you're out there for hours at a time, make sure to stay hydrated. This can increase your vascular supply and help prevent ischemia. I don't know about you guys, but I definitely learned something new today, so stay safe when you're out there surfing.